chronic cough is usually one that lasts for more than 6 weeks. Broadly speaking, there are 3 main categories of causes. Firstly, problems within the lung, and this may include diagnoses such as asthma, pneumonia, or scarring of the lungs. In addition, there may be problems with the nose or sinuses, and this may result in phlegm or mucus dripping down into the throat that causes a cough. Thirdly, there may be problems with acid reflux from the stomach into the throat that irritates the throat, resulting in a chronic cough. And it would be important for your doctor to take a detailed history to try and clarify which one of these groups of causes is responsible. In terms of when a patient may want to see a doctor with a chronic cough, may depend on a number of factors. This may include the length of the cough, the impact of the cough on that person's quality of life, and also whether it is associated with other symptoms, for example, coughing up blood, or fevers, or pain in the chest.